One, five, four, three, two, one. Good evening, everybody. It's your girl, Miss Iha, Trish, as everybody knows now, coming to you tonight live from all the way from Mobile, Alabama, with our I don't know, we'll be on like five, six episode of Journey with Trish. Now we've been being consistent. We missed last week because it was Mardi Gras, but here we are. Before we get started, let me go ahead and give y'all my medical disclaimer. Neither myself, Ihada Jimenez, aka Patricia Reed, Taisha Davis, Tashina Wesley, Toy Netta, or any of our affiliates or employers or any other associations that we are connected to are giving any type of medical advice tonight. This is all our professional and personal opinions. So if you are having any type of medical emergency, we will direct you to the nearest emergency room, urgent care, or call your primary care provider. So I have with me on my right, this is my niece actually, Miss Taisha Davis. Hey.
Hey y'all.
And right over here to my left, I have my bonus baby, Miss Tashina Wesley.
Hey y'all.
And over here to the far left, we have my new sis, Miss Toy Netta Cooley, who is a nurse practitioner who specializes in cardiology, works over in Pensacola Baptist Hospital, correct?
That's correct.
All right, so we are going to be talking to everybody about something very, very, very important tonight. I'm going to let Taisha just go ahead and tell you a little bit about herself, and then I'll let her tell you some of her story. And as she's telling her story, we'll also actually we're going to start with Tashina because Tashina she experienced it first.
Did I?
You did.
Yeah.
Right. Yeah.
Oh, I feel like you told me that, Taisha.
Yeah. So we'll start with Tashina. We'll let you get into your story, and while you're talking, we'll ask you some questions about it. But before that, I was going to say, before I do that, whew, one of those moments. Anyway, I got to tell you what we're talking about. A very, very important topics. It is called peripartum or postpartum cardiomyopathy. And it is a condition that is affecting our young Black women at increasing rates. And I was telling you a little bit earlier, Toynata, that when I would hear people on Facebook, Black women on Facebook or TikToks, saying how they were being ignored at physicians' offices and how we really had to advocate for ourselves. Like I really, really did. I thought they were making a big deal out of nothing until, like you said, it kind of hit close to home. Right. And so it is very true that a lot of times we are overlooked. And so it's nice to have someone that you can reach out to you in your family or somebody that who can kind of coach you on what to say. Let me let you go ahead and explain peripartum or postpartum cardiomyopathy before Tashina gets started.
So it's actually a condition that happens in the last trimester of pregnancy or up to 5 months after pregnancy. And what happens is the body's reaction to the amount of fluid, it makes the left side of the heart very weak. And so patients will experience increase in shortness of breath, swelling of their ankles really bad, high or low blood pressures. And so all of those symptoms sound very familiar when you're pregnant anyway. Mm-hmm. So they're like, get over it. You can't lie flat. You're having a racing heart rate. And so basically they think, okay, this is just a part of your pregnancy. But if you know that you know your body more than anyone else. And so the important thing is to keep screaming something is wrong. I know something is not right. And yes, it is very good to have someone in healthcare that you can talk to say, hey, what do I need to say? Because nobody's listening to me. So actually, this is a condition that can be treated. And so that's the good part of it. And we'll get into the other parts of it as we go on. Okay. But yes, it can be treated, and it is a part of heart failure. It is classified as under heart failure, but it definitely can be treated.
Okay. So Tashina, tell us like from the beginning how it all started. When did you know something wasn't right?
Okay, so that's basically my story. I I had my baby, and I was in the hospital. Well, let me rewind. So before I had my baby, I noticed I was picking up a lot of weight really fast. So I know in 1 week in particular, I gained over 10 pounds.
Wow.
So I contacted my doctor and I told her, hey, something is wrong with me. I was like, it's just weird. I'm just put on a lot of weight. And I remember looking online because I will self diagnose myself real quick. So I remember going online, I'm sure WebMD or something. And I remember it said, like, if you could push down on your skin and if it doesn't, like, pop right back up, or it's some kind of way you can tell, like, with the swelling. And it did that. So I contacted my doctor. She was like, you're fine. You're fine. You're fine. So I had my baby, which I had a C-section. So I retained a lot of fluid. And I went home after 4 or 5 days and I was extremely hot. I had like literally, I remember one particular situation. I was walking around with just a bra on and like some bottoms, and my mom came over and she was like, it's so cold in here. I was standing, my baby was a newborn baby. I was standing in front of a fan with him. I was like, we're so hot out. She was like, no, you're hot. He's not hot. And I was like, no, we're both hot. We're sweating. Like, I don't feel good. Just like super lethargic, just didn't feel well. And I contacted my doctor and she said, if you're, and I have shortness of breath. And she's like, if you have shortness of breath, just go to the hospital. I went to the hospital. I stayed in the hospital 6 days. After that, by the time I left there, I'm pretty sure I was roughly like 26 pounds less, where I went down to my dry weight with them just pulling fluid off of me.
Can I ask, excuse me,
Sure.
can I ask real quick, did they do a ultrasound of your heart?
Yes.
Okay,
So
good.
my advocate.
Okay.
Well, I advocated for myself because, at first she just kept telling me like, no, it's normal. It's normal. Because, that can seem normal with pregnancy, you retaining fluid and things like that. And so once I got in, they started checking my heart and different things like that. So we had a heart doctor come over. They monitored EKG, ultrasound. So I was under the care. That's why I was in the hospital for that week. I was under the care of a cardiologist because my heart had weakened and I had, such a large amount of fluid on me that would not drain properly. So my body didn't get rid of it. So I just retained more fluid. She came, laid on the couch with me, told them that, something's got to give, like something's not right. And thank God for that, because I was, we were able to get through to them that something was seriously wrong with me. But my early on symptoms definitely was shortness of breath, very hot. I can just remember how hot I was. Like I could not cool off or anything. Just didn't feel well. Like, and if you've had a baby, of course you go through the motion, but this was different because that was my second child. So this was different for me. I had never felt, it was almost like I was sick. Like I was coming down with something, maybe, I was very lethargic, and very fatigued. And I just remember standing and I was like, how crazy. I was standing in front of a fan with a newborn baby thinking that both of us were so high when really it was just me. And it was the amount of fluid on me that made me feel like that. So I stayed in the hospital for a week. They pulled the fluid off of me. They recommended that I, waited, I think she said roughly about 2 years before I even tried to have another child, which I did after that. So I did have a child 4 or 5 years later, and I did not have that problem. But I also made sure that I kind of watched everything. Like I was very adamant about like, okay, if I gain this much or, different things like that. It just made me really nervous from that first experience. I did not have to have surgery or anything like that. It was treated. Like I was able to be treated. So it is treatable.
Right.
But it's very rare. It is very rare, and it is happening to us at such an alarming rate.
I was just going to ask, how many times did you call the doctor's office before they just said, we'll go to the emergency?
Oh, multiple. So multiple times I called, and it was just dismissed. Like it's pregnancy. And I knew once I told them like, hey, once I started experiencing shortness of breath, like I knew then like, okay, they're not really rolling with me. Like I have to I called, I left the nurse a voice when I was like, no, I want to speak to my doctor. And and she told me then, she was like, well, just go to the hospital. She didn't say come in and thank God that she did tell me that, because who's to say I still wouldn't have been sitting at my house waiting, on them to finally listen to me. So I had to call my doctor several times, and I for sure made it a point to tell her when I was in the hospital. I was like, I tried to tell you that something is wrong with me. And of course, she dismissed it as, it was, it could have been anything, or, whatever it may be. But you know your body and you know yourself. And it's so important that you advocate for you, because no one's going to care about your life like you care about your life. So if you know something is off with you, no matter, I called them several times, and I'm happy she did tell me, go to the hospital. Eventually I probably would have, on my own, but who knows how long I would have suffered there before I would have went.
And it's, and that's when it's very important to have a good health history. People can't be afraid to, speak out to your provider. That things can be said and done in a respectful manner.
For sure.
But definitely, if they're not listening to you, you have to be adamant. You can ask questions. You shouldn't be afraid to ask questions or afraid to make those phone calls, because all of those symptoms that you had, very first thing, would have been, okay, listen, I need to see if I can get you in with a cardiologist today, or I'm going to go ahead and schedule this while we're waiting for that appointment. And probably could have avoided the hospitalization, by going ahead and getting the EKG or getting that ultrasound of your heart done. So therefore we can see, okay, what's her ejection fraction? How much is her heart truly pumping? Because normal pumping function for any adult is 50 to 60%. And so typically patients with postpartum cardiomyopathy would drop down to 20, sometimes the teens. I saw a young lady before who was like 10% when I met her. Wow. And she was very young, in her 20s, but she was literally on her 5th child. And so that's one of the side effects is multiple births. And she probably weighed 110 pounds, so multiple childbirths, a history of hypertension, a history of family heart disease. These are questions that should be asked when you get pregnant. It should be a good, strong health history there. And if that health history is not taken, that's a concern. That's typically a concern.
And so that's why I always tell everybody, people think that your yearly well checks end when you stop being a child. They don't. You should have an established primary care provider. The urgent care doctor is not your primary care doctor unless they have an established primary care section of their clinic. So everybody, you want to have somebody who, if you start to have some symptoms that are not normal, like she said, you have a relationship with somebody that already knows you and that's comfortable with you and you're comfortable with them, so that you can go and visit your primary care provider.
One thing I did learn, because I just got blood work, is I'm only 30, but and I just went to my doctor. She gave me a full workup. And one thing that stuck with me is that she said, even though I'm healthy, this is a good baseline. So if, it's just good to always have a baseline on what your healthy numbers are. So if something is wrong, when you do have more blood work, they're able to compare that. So that's something to keep in mind.
And be leery. Speak up for yourself, because a lot of these primary care doctors are not getting your yearly labs. They are not. And that's something that you should be requesting if they aren't, whether it be your primary care or your GYN. When you go to the doctor, at least 1 year, I tell everybody, go your birthday month. Get your labs done every year around your birthday month. Get your mammograms if you're that age, or your colonoscopy, whatever you're supposed to have at that particular age. Know your family history. Make sure, because some of those things, like a breast exam, you would get earlier if you do have a family history. So know your family history as well. Taisha, tell me, when did you know something was off?
So my pregnancy was normal, completely normal. My birth was normal. Everything was fine. The first sign of something being wrong was I needed a blood transfusion in the hospital. My blood was not circulating as it should, but they gave me a blood transfusion. The same day I went home. Blood pressure was elevated, but I still went home. Um, I went home for like 3 days and I was experiencing shortness of breath. I could not even sit up to feed my baby. And like day 3, I was like, no, I got to get up. I got to go to the hospital. Something's not right. Get to the hospital. My blood pressure was 225 over 205.
Oh, wow.
And I had, by the time I left the hospital, I had 38 pounds of fluid on me. But while I was in the hospital, I was pretty much like a guinea pig. They really didn't know what was wrong. My organs began to shut down, and I was given like a magnesium treatment to like slow everything down to put my body at rest. But I was pretty much a guinea pig for about 2 weeks. And at the end of it, it was just body fluid retention and hypertension. That was it. They knew that when I first got there, they did say it was cardiomyopathy with postpartum. But by the time I left, that was not said anymore. It was just hypertension and fluid retention. And then a couple months passed by and I had a heart attack out of nowhere. I drove myself to the emergency room, but didn't even make it into the emergency room. Time passed by. I kept having a racing heart, shortness of breath, blood pressure just elevated to the 200s again. And then at this time, I'm seeing a cardiologist, but they're still not pinpointing exactly what is wrong. They're not associating it with the pregnancy. They're just trying to figure out what's going on. After about 10 months or so, they realized that my heart was not functioning as it should. And then 2 months after that, that's when the testing became more serious as for my heart. And I started seeing more specialists. And they realized that my valves weren't pumping as they should. So over this past year, I'm just going about my daily life, but something's terribly wrong with my heart. And then I found out that my mitral valve wasn't opening and closing as it should. So I had open heart surgery and had a mitral valve repair. Since then, my body still retains fluid. I take diuretics daily to get that fluid off of me, and my blood pressure is still elevated, and I take so many medications, but I feel like it could have been avoided early on if somebody would have just paid a little bit more attention to my health.
And you know, everything that you've said is what I take care of every day.
Yeah.
I mean, so you started out literally with the high blood pressure and getting the blood. So when they sent you home after that blood transfusion, actually your heart probably was already weak at that point. And so giving you the blood plus the high blood pressure was actually adding more fluid onto your heart. And so what happens is, just imagine like if you were to blow up a balloon, and this is exactly what I tell my patients. You know, you put water into that balloon and it's going to just stretch and stretch and stretch and stretch. That's what's happening to the left ventricle of your heart, okay? That bottom left side is just stretching out. And so where our heart is supposed to squeeze tight like this to pump that blood out, blood and fluid out, yours is actually squeezing like this, okay? Because it's just weak. It can't, it's like the fluid is just piling up. So that mitral valve is on the left side of your heart. And so what's happening is a valve in our heart, the way God made us is so amazing. You know, the valves are made just like any other valve. A valve in a car, a plumbing valve, they're made to open and close, open and close, open and close. And so when you have a lot of fluid in that left ventricle, that fluid is pushing against that valve, and that valve saying, I don't know what to do. Do I stay open or do I close? You know, so it just leaks. So you have mitral valve regurgitation. Okay. And so that's just leaky fluid back into the bottom portion of your heart, because you know, when your blood pressure is elevated, that's fluid retention. That's extra fluid retention. And so when they sent you home, then, and they're giving you diuretics and you're getting thirsty, you're getting dry mouth, and you got to drink. You think, okay, I got to drink. I'm so thirsty. But you're not supposed to drink so much. You're only supposed to have up to 2 liters of fluid, you know. And so if I send you home and don't tell you that, and your heart is already weak and you putting all that extra fluid on, they get it off in the hospital with the IV fluid, with the IV diuretics, which is good. But then we dry you out, like you said, to your baseline weight. And then you can walk by a refrigerator and gain 5 or 10 pounds. You know what I'm saying?
Yeah,
because
sure.
you go back to your everyday living and nobody has taught you what should my diet be now. You need to be monitoring your sodium intake. You can't go and eat the McDonald's and all of the extra things that's going to have salt to them. And a lot of our frozen foods and canned foods, they have they're high in sodium, which causes us to have elevated blood pressures.
And so you guys, I want everybody to be listening to this, whether you be male, whether you be female.
Oh yes.
I want everybody to listen to this part of it, because hypertension, if you were born Black, you are already at risk for developing hypertension. And so these are some ways that we can combat hypertension that we call lifestyle changes.
And so what you should be doing, even when you come home from the hospital, they should have said, okay, you need to get up in the morning time, you need to empty your bladder, and you need to get on the scale and weigh yourself. If you gain 3 pounds in a day or 5 pounds in 1 week, I need you to call me. Okay. Or I need you to take an extra Lasix or whatever the case may be. You need to check your blood pressure every morning before you take your medications. Okay. So that's telling me, okay, how do we need to adjust your medications if they're not working for you? We need to know that. Those are all important factors. But if nobody's teaching, if nobody's doing the education, and you're being used as a guinea pig, while you're in the hospital, then that's not good. It's really scary. It's unfortunate. It's very unfortunate today, because we really need healthcare providers who are listening to the patients, just the same way as when we were doing bedside nursing. You listen to your patients, because your patients, they gonna save us from a lot of stuff. But in the same way as a healthcare provider, but it's very unfortunate. It does happen. It does. Postpartum cardiomyopathy falls under heart failure. Does it mean the heart is failing? It's just failing to, it doesn't mean that you're getting ready to die. It's failing like it's going to stop in a minute. It just means that it's failing to pump the adequate amount of oxygenated blood out to the lungs and the rest of the body. Okay. So, yes, patients stay cold, versus being hot. Okay. Because when your heart is weak, because it has to send that oxygenated blood to the important organs of the body. So you might have cold fingertips, cold toes, those my feet are cold all the time. I got my socks on, because it has to send it to those areas that's more important, your kidneys, your lungs, your liver, all the other places. But yes, those are
And so Amelia wants me to tell everybody that uncontrolled hypertension is a risk factor for leading to chronic kidney disease,
yes,
which also eventually leads to end-stage renal failure. And then also hypertension, puts you at risk as well for a stroke. So listen, like I said, you were born, most of the people that's watching, we born Black, so we already had some strikes against us there when it comes to hypertension. But there are some things that we can do. And for some people, honestly, they're short of taking medication.
Walking,
their genetics will
exercise is also good. And even when we tell our patients, to get out and walk, we don't mean the brisk walking, just leisure walking, just getting out and walk, because the heart is a muscle, and if you're not using it, you lose it. So obesity is a risk factor. Of smoking, cocaine abuse is drug abuse, smoking weed, family history. And when we say family history, I don't mean cousins. I'm talking about your mom, your dad, your maternal mother, father, or sister, brother, or any other siblings. So it's important to ask your mom, hey, are you taking any medication? What are you taking that for? Because you want to know the anemia, the diabetes, uncontrolled diabetes, hypertension, yes, can all lead to kidney disease. And unfortunately, the medications that we use to treat heart failure or cardiomyopathy can affect your kidneys. So you should be having frequent blood draws. So you should know your baseline, so you'll know what's off when you start getting your lab work. Please sign up for patient portals. Sign up for, I'm gonna say it again. Sign up for patient portal, because you're waiting. They never call me about my lab results. Well, you're on patient portal. You can go see your lab results. You can get them just as quick as we can. You can even see nowadays you can see what your physicians even put in their note. I've had somebody call me one time and say, "Can you take that out? I don't want nobody to know that but literally, and I'm like, no, ma'am, I cannot. I'm sorry. But sign up for patient portal, because you should have access to all of your medical records, all of your tests. And then that way you don't have to go to the hospital and wait or pay money for them to give you the paper form of it.
And then, I am so much of an advocate for the elderly population, but, we unfortunately in the past, 5 years, I don't know, it just seems like to me we're just losing people younger and younger. So it's so important, that you do identify somebody when you go to the doctor. Don't worry about what they're going to find out. Somebody needs to be able to get to your records if you need them when you can't. If another doctor wants your records so they can see what your history was at your other doctor's office, I can't just go in there and ask for my husband's records if he has not put me down as an authorized, how you say it? An authorized, I can't do this every day.
I know, I can't even think of it either.
Well, they're going to ask you who, and it's not just a next
a contact person.
A contact, well, not just a contact. It has to be that they have access to your records, though. A release of information. Release. Yeah, a medical release. Okay. Your husband or an older child, somebody needs to be down as somebody that they can call if you are incapacitated, if you can't make a decision. These are things we all need to start thinking about now. Don't wait because when it was very difficult for my dad and I to get things from my mom when she got sick. And so when she got to the point where she got well, we went and got it together. We got everything squared away for her and him. And Chris, I make sure that he puts my name on all of his doctor's office appointment. When he goes to the doctor and they ask who you want to put down, you need to put somebody down there like you're putting somebody down on your banking accounts, so somebody can get to that stuff if they need to, because you'd be surprised when you may need it. One of the things we needed to for with my mom was as far as insurance. Needed to be able to file some insurance, and they needed records from the doctor's office, but the doctor's office wouldn't give them to us because neither one of us were down as having a release for us to get her records. It takes a long time to go through a judge to get that kind of documentation. So everybody, make sure it does not even cost a lot. There are several people who have gone into business who are just helping you create healthcare proxies. They have online apps where you can go and identify healthcare proxies, take it and get it notarized. Bam, you have somebody who's going to be responsible for you if you cannot make those decisions on your own.
And you can print those off too. There are copies of a healthcare proxy, a general form, just a generalized form. It doesn't have to be anything very lengthy that you don't understand. But as long as you have it notarized, that's the biggest thing. You have to have it notarized with a witness, not just a notary, but another witness too. And you can make that and give those copies. Just give copies to each physician's office that you go to and say, hey, I have a healthcare proxy, and I want to make sure you guys have it on file. So
it doesn't matter how young. It doesn't matter how young you are.
I can tell you my first patient as a nurse practitioner with postpartum cardiomyopathy was 14 years old. She got pregnant and did not tell anybody until it was time to deliver. And all of a sudden her stomach was hurting. And she went to the doctor and they sent her to the hospital and she had a baby. Unfortunately, the baby died. because the baby was very, unhealthy, because of her not taking care of herself or not telling anyone so she could get the care that she needed. And so her body just rejected. And that's the thing. And the thing about it is why postpartum cardiomyopathy happens is unknown to this day. There are many ways to diagnose it and try to mark out whether or not this is true postpartum cardiomyopathy. And many times, we have to tell patients, yes, wait 2 years before you have another baby, or wait 5 years. I've had to tell a young lady to never get pregnant again.
Yeah, I was told to never.
Yeah. So, and that was, and the physician didn't want to have that conversation, but I'd rather tell you never have a baby again and you have your life for your children that are here now,
Sure.
than for me not to tell you, and then you get pregnant again and you lose your life, and then your children are without a mother. So those are hard conversations that we have to have sometimes with patients. I like providers who are honest with me, not beating around the curve. I just put it out there and let me deal with it the way I know how to deal with it.
I don't even know who I was talking to the other day. But I remember somebody telling me who had also went through this, that it was their husband who the doctor had actually, told them that he needed to make a decision if something happened. Which one would you want us to try?
I've had a lot of hard conversations with patients that have heart failure. And even though I'm using the term heart failure, cardiomyopathy is heart failure is some type of cardiomyopathy. Whether it is, based from the tachycardia or the rapid heart racing, any type of arrhythmia, metabolic syndrome metabolic cardiomyopathy is inclusive of so many things, anemia, acute anemias, uncontrolled diabetes, uncontrolled hypertension, rheumatoid arthritis, chemotherapy drugs, radiation treatments. Is so much under that umbrella, that falls under that umbrella, and they all have heart failure symptoms. And so the valve disease, all of that. And typically, if you can, with the mitral valve, if you can control the hypertension and control the fluid, the valve will close itself if it's controlled and if it's caught in time. But then it'll get so bad at some point, then patients have to have mitral valve repair.
So I have a question. Is it normal? I know in my case, it was caught very early on, but with her, I know she said, she's almost a year before she's even seeing specialists. Is it normal for it to take that long? For it to be, because to me, I feel like a year is a long time for them to say, hey, something more serious is wrong with your heart.
But I had a lot of, I have heart disease now. It wasn't treated like it was treated for you. So I knew I had the cardiomyopathy when I went back to the hospital after I gave birth. But all of the extra that was going on, that's what really took that year to figure out, when you have this surgery, what all do we need to do once we get in there. But it wasn't just them trying to figure out if it was cardiomyopathy or not. Yeah.
So it makes me wonder. So first of all, it just makes me wonder, did anyone pay attention to the ultrasounds of your heart when you were having them done? Did anyone notice from the first one that you had to the second one that you had, are our numbers changing? Because when we look at valves, we look at numbers. We look at the valve area size. We look at so many things. We want to know, we send patients for another type of echocardiogram or ultrasound on the heart, but it's called a transesophageal, where we actually,
I had that.
because we have to have that one done before you have the actual surgery, because it's giving us a better view, because it sits right behind the esophagus. So it gives us a better view of it, or it gives the cardiologist, not me, That's out of my pay grade. But it gives them a better view of it prior to getting ready for the surgery, you know. And so it just makes me wonder if anybody was monitoring that during that time, because you should have had one at least, you know, from the beginning to maybe 2 to 3 months after, 3 months after that. And then so if you went from the first one to 8, 9, 10th month, it very well progressively got bad really quick. So if it was caught at that 3rd month, then we could have probably diuresed you even more with Lasix and controlling that blood pressure, and then that would have helped that valve to close.
So like when you got out of the hospital, did you follow up with a cardiologist and do everything they told you to do, and then you still progressively got?
Yeah, I did. But I don't know. It just wasn't like a straight answer for me. So I had all of the EKGs and the ultrasounds, but I would also have like stress tests and everything's fine. Or I'll go to the cardiologist and it's like, oh, you sound good. But then I'll go see the cardiologist maybe a month later and they say, oh, your regurgitation is bad. But it's like, is it good? Is it bad? I never really got really clear answers to what was going on.
So, you know, sometimes people will listen to you and we want to know, whenever I have a lot of patients who have valve disease, okay? And like I said, if you get the fluid off, okay, if I'm treating your fluid, so I may hear a murmur. They might have told you, oh, you know, you got a heart murmur, you know, and so that's just the sound of that valve, that blood flowing back, because that valve is not closing tight. And so if you're being treated properly, yes, on the echocardiogram, it may say, you know, you have a murmur, have a mitral regurgitation or mitral stenosis, which is a stiff valve. And so, but if it's controlled, you won't hear it, you know, with the stethoscope. But then when it's bad, you know, or it's not being controlled, or you have a lot of fluid on your heart, then it can be very loud. And so it just makes me wonder, like, did they listen to you?
It was a long process because even for like a month, I was monitored 24 hours a day with the monitor that went on my chest.
So the monitor does not. So they likely put the monitor on you because of the rapid heart rates you were having to make sure you wasn't having any other type of arrhythmia.
Yeah, okay.
But it does not monitor your valve. The only way to look at your valve is through an echocardiogram or the TEE.
So this is why you guys, you got to have somebody that you know that can advocate for you, that works. And you got to have a primary care doctor. I can't stress that enough. And I'm going to say this, and I don't want to offend anybody, but the fact that your primary care doctor writes you the prescriptions that you feel like you want or need does not make a good primary provider of such, okay? You know, when you have a cold or when you have these headaches, how your primary care provider is handling you. You know about the amount of time your primary care provider spends with you during your office visits, whether they are a good primary care provider for you. The number one thing that I hear, and that's as a psychiatric provider, is that this is the longest I ever stayed in a session, you know, because like for me, a psychiatric evaluation is 60 minutes. And most of the time you're going to be in there that whole 60 minutes because I'm going to listen to what you say. And that shocks them. But it shocks me that everybody else is not also listening to everything that they have to say. So you do need to be with the provider who is listening to what you have to say. If you are going in there and telling your primary care provider what you want them to do, that does not make a good primary care provider for you. I don't care if you get two. One who's going to write you what you want when you need it, and one who was going to really take care of you. You need somebody who is going to take care of you and listen to you. Okay? So that's your assignment. I need for everybody to go and find a good, and I know they are few and far between right now, unfortunately, and because everybody is moving to Baldwin County and everybody is moving, Mobile was already full, and now Baldwin County is overloaded, and there are not very many primary care providers, but we do have some new ones, some new clinics opening up over in Baldwin County. Find yourself a primary care provider, somebody who will, that's like I tell everybody, that's your quarterback, right? That's the person who you're going to go to if you are having a headache or a foot ache, or if you're depressed, because if they can't take care of you, that would be who would refer you to a cardiologist if you need to see a cardiologist, or a neurologist or whatever, endocrinologist. So I thought that was going to take up most of the time, and how good it was. I hope that somebody out there has learned something about those particular topics, but even more so than you learning about postpartum cardiomyopathy, I hope that you have listened to us say you need to have a relationship with the primary care provider, somebody who will be responsible for your care, that you trust and that you have, like I said, y'all should be able to come in and sit down and talk to your primary care providers like you and I are talking. And you should be getting your exams every year, not just when you have a cold and not just when you have a headache.
And let me just interject for 1 second, one quick second. Unfortunately, there is a shortage of primary care providers, not just in the Mobile County area, but Pensacola as well. So ask your family members, ask someone, your friends, who are they going to? Because a lot of people that I see, my younger patients, right now, my youngest patient is about 18. They, come in because their mom brought them in. But most of them, somewhere between 30 to like 50, they'll tell me that they've never been to the doctor, they never had high blood pressure, and their blood pressure is out of control. When they came into the emergency room, they think that one incident made their blood pressure go up. No, that's why they call hypertension a silent killer. Okay, because you'll never have any symptoms. Typically patients will wake up in the morning time with headaches. Typically they'll have blurred vision, those type of things, but not all the time. Some people never know, and then they'll go somewhere and they'll take a blood pressure and it's elevated. So just please ask around. Ask, word of mouth is better than anything, because that's absolutely there is a shortage, but I'm sure there are some out there that I know there are a lot out there, good ones that still have openings.
And some of them will take you. Sometimes you got to know somebody to get in.
Yeah.
All right. So our next topic is going to be surviving teenage pregnancy. And I'm pleased to say, last time I checked, though, our numbers were going down as far as teenage pregnancies. Both of you guys have survived.
We made it through.
Made it through. Kudos to you.
Yes. Kudos to us.
So tell me, looking back, and I believe I asked you this question the other day, Taisha. If you could have because how were you when you got pregnant with Trent?
I was 15.
Okay. So if you could go back, if you could have
back, I was 16.
16.
Yeah.
All right. So if you could have waited and had the same child, but at a later time, would you have waited and had her later?
When you asked me the first time, I said I would have waited. But after I thought about it, no.
Okay.
I mean, that's bad. I don't condone having a baby at 16, but I wouldn't change it.
Well, tell me more.
I don't know. I mean, now I have a 2-year-old, and I promise I don't have the same patience and amount of energy that I had when I had Trent 12 years ago. So, no, I wouldn't change it.
And so it didn't make life any harder for you?
I mean, life was hard, but it taught me independence very, very early.
Had to grow up quick.
Grow up really quick. Real quick. I was a baby raising a baby, but we grew up together.
Do you feel like you missed out on anything?
At the time, I did feel like I was missing out on like what my friends were doing in prom and stuff like that. But now being an adult, I didn't miss anything. Like the fun is now as an adult.
Okay.
I didn't miss anything.
And how about Tina? How old were you when you
So I was 14 when I got pregnant, and I had him when I was 15.
Okay. And what about you? If you could have waited and had the same child, but years later, would you have waited?
100%.
Tell me why.
And I say that because I love him to death. That is like my rock. We grew just like you and Trent. We grew up together. But I do think that you can make your own life harder for yourself.
Mm-hmm.
So even though I had a great support system, his family, his dad's family was amazing, helped us so much. It wasn't necessarily missing out. It was just more so when I went to college, I was, he stayed with our with, his family. I still worried about him. Like I couldn't be as like free and just as I wanted to. So I personally would have waited. If I could have the exact same child, 5 years later, I for sure would have waited. I think that it puts a different type of like stress on you. And not necessarily just from the child. I just think from just your community and just friends. And I'm just looking at it from all aspects. Like for me, thank God I made it through there. But it was a really, really dark time for me. And with the support of my family, like I thank God that it was, I was able to maneuver through that situation. But I definitely think you can put a lot on yourself that you don't have to have. Like my friends, they were away somewhere spring break. I'm at home with the baby. My friends, they get in the car going to the center in Bay Minette. I'm at home with a baby. Not that it matters now, because like she said, my fun is now. I have an amazing time now. But at that time, that was fun to me. And I wasn't getting to experience those things. So I definitely think that I would have waited. But would I do it over again for him? For sure. For sure.
Okay. Do you have any children?
I have boys, but I was actually 21 when I had my first son. So, and even at 21, I was not anywhere finished with school, but it did help me. I can say that it helped me to see things a little bit clearer.
Sure.
It helped me to notice that I needed to stop playing around and get myself together. So I'm gonna be honest. My boys were my motivation. Actually, for me, it made me say, "Okay, girl, you got to get your coins together because you can't keep staying like this." So it actually just kind of pushed me forward to see that, hey, you need to wake up and it's time for the club. And so, for me, the club thing, when it was really time to go to the club, instead of trying to go to the club underage, now that I'm legal, it's like, I don't want to do that. I did that. I'm done with that. So, it actually helped me to open my eyes and see, because I was really just playing around, honestly, just playing around, wasting time, and my parents' money too. A lot of their money.
It for sure opened my eyes. I mean, getting up, imagine, you have to think about this. You don't think about it in the moment because, you're not thinking about, I'm going to have a baby, but you have to go to school the next day, getting up, fixing bottles through the night, a baby crying, a baby sick. That is a lot on you at 15, 16. That's a lot on you. Yes. I mean, at 28, I was a walking zombie. So I don't even know how I made it through it then. And one thing about my mom, I was so mad at her then, but I love her for it now. My mom did not get up and fix bottles for me. Like my mom was like, you had this baby, you're going to fix bottles, you're going to change them. She would knock every once in a blue moon wash them. But my mom, I'm not gonna say she made it hard for me, but she made me be a mom.
Like that's your responsibility.
Yeah, like she made it clear that this is your baby. I love him to death, but this is not my baby, and you have to do this. So I would go to school. Yeah, I would go to school, and I can remember being so tired. So that's why I go back to, like, of course, who wouldn't want to sleep all night and wake up and not have to worry about anything? But it taught me so much, and it made me so independent. Like if you could see independent in the dictionary, you're gonna see my picture. I really, from that age, I got my first job, I bought my own car by myself. Like I just really it just turned up a different hustle in me. Like you said, like I gotta really get about my coins. I really gotta get about my education. Yes. I really have to make a way for us. And so it did motivate me in ways that I don't think anything else in the world would have. It definitely pushed me to limits that I probably didn't think I could go to, but it definitely helped.
Took you longer to get there.
Yeah, it would have took me longer to get there. Yeah. For sure. For sure.
So I got pregnant when I was 18. I had Shemaya at 19. And I got pregnant on purpose. And I'll tell anybody, having a baby early did not help me one bit. It did not help me at all. I was totally, because my parents were total enablers. You know, they, like, my mom did so much. So they were total enablers. And, you know, I still, and if my mama didn't have them, your mama had her. And if your mama didn't have her, your grandma had her. So it did not, I'm not fancy here lie to y'all and tell y'all that it helped me. I had her on purpose because of my childhood trauma, and my whole goal was to have this child that I was going to protect and keep anybody from harming. But I was still so harmed in myself that I could, like, I'm totally honest, I could have been a better parent than what I was. I don't honestly think that I got it right back then, because somebody should have taken me to a therapist's office way back then and had me deal with a whole lot of stuff that I didn't deal with. And so what I would want everybody to take from me tonight is, if you're young, if you got any young people out there that you can tag or share this with, if you are going through something, you are looking for somebody to love, it's not always the answer to go and have a child, because I would want for you to go to get some therapy to learn how to love yourself and how to forgive yourself and how to forgive the people that hurt you, before you now bring a child into the world who you feel like you are just going to like you feel like that's going to be it. I'm going to have this baby and everything is going to change. It does not always happen that way.
Not even young adults. Adults do that too.
Yes.
Adults that are in unhealthy situations, they have babies hoping it'll keep things together or whatever it may be.
True.
Babies do not fix that for you. If anything, it puts more stress on the situation, because it's a lot raising kids. We all have children. It's a lot raising children.
And you got to find somebody that you can trust, that you can talk to, you know, that will listen to you or lead you to the right person. Like you said, if you can get therapy, that's good. A lot of the jobs that you have some type of insurance for you. That EAP program, when you see that EAP, don't feel like, oh, that's just something that they're gonna just blast around the job. No, this is legal. They cannot share your information. You utilize it. I've utilized the one with my current job before, and it was very eye-opening for me. And she basically told me some stuff. I was like, I don't know if I'm coming back. And then gave me homework to do, and, you know, things that, you know, just like how to set, you know, just basically flat out told me you don't know how to set boundaries, you know. And that's, you know, something that, you know, are a lot of us taught to do that, you know, because if we quick to say no, I ain't doing that, you know, we're quick to be labeled, you know, as being angry or, you know, or just defiant or whatever the case may be. But there are ways to set healthy boundaries. And so a lot of jobs, even some of the fast food jobs, have EAP programs because mental health is so much needed. And then we think that as Black women, oh, you know, we can't get depressed, you know, girl, you better take it to Jesus. Yeah, Jesus gonna help us, and he gonna lead us right back to that EAP program for someone,
just like he led us to the cardiologist.
Yeah, so you know, he also leads you to your physician, and you know, your physician give you medicines, and you know, you pray over all of that. You know, you got to pray about the situation, but find somebody that you can talk to, that you can trust, you know, that's gonna and if you feel like that's not somebody you can talk to, don't go and talk to just anybody. You got to talk to somebody that's helping you. If you don't feel like they're helping you and they bringing more harm to you, that's not the person.
And that's why I always say establish services with the mental health counselor as well. If you are dealing with any kind of depression, of anxiety, of PTSD, establish that care with a therapist, so that even when you're fine today, there might be something later that's going to come up. And that the hardest part about a therapist is sitting down that first time and unloading. And so now that you already have an established care, with somebody that knows you. And now 6 months to a year down the line, when you're going through something again, all you got to do is pick up the phone and say, hey, Eunice from ECM Counseling, I need to come in and schedule an appointment. And so she already knows everything about you. She's going to go pull out your notes. Eunice probably just going to remember anyway. But she got her notes she can go read over. And then you come in and then you pick up from where you left off and not have to start all over. So let's use that segue, though, into our last topic, which is mental health, And so we're going to try to make it a little fun. Let's have a Mardi Gras recap. Y'all, did you see your girl at Mardi Gras? Listen, did y'all see me go to 3 Mardi Gras balls? The first one that had probably 700 people there.
Oh, wow.
And that was in Daphne. And then the second one, where did I go next after Daphne? Oh, no, the first one was going to be Connie Explorers. And it was, I think they said it was probably about 700 people there. And then 700 people in Daphne. Tech, how many people you think they have at the Grand Marshal Ball? I know I saw at least 400 tables. About 4,000 or 5,000 people. So your girl was at the Mardi Gras Ball with 4,000 to 5,000 people in at the best time.
Okay.
Oh my gosh. I had the best time. And so what I did was cause exposure therapy, because for the longest time, I did not go to large events at all. And then it became that I would only go to an event if it was my event. And that wasn't out of selfishness. Is that at my own events, I felt comfortable, because if I want to go to the back, I can go to the back. If I want to shut it down, I could shut it down. I knew where all the exits were because it was my event. Well, you can't keep asking everybody to come and support you at your events and you never go support anybody else.
Not talk about that.
So I started going. So I decided this year, last year was the first year I did go to a Mardi Gras ball for the first time last year, and that was Original Dragons with Natasha, who has kind of been my person, who has kind of pulled me out of the house and made me feel comfortable even going to events at all. So that's like, you got to find a person for each little thing in your life. You should have a person, like I tell everybody, Eunice is not going to be my person to pull me out the house to go everywhere, because she's not that friend. But Natasha is. So it's okay to have more than one person to do different things. And so I went to the Grand Marshal. I was supposed to go to 2 balls. I was supposed to leave the Grand Marshal Ball and then go to the sneaker ball. That's why y'all saw me with those sneakers. But baby, when Blue got on the stage, that was it. It was no need for me to leave. I was done. I was too busy trying to figure out which door he was gonna go out to be worried about going to the sneaker ball. So listen, if you guys, that's another part of going to therapy. They will guide you through things like that and give you tools that you can use, or things that you can do to make it so you can be strong enough and comfortable enough to show up on Sunday at the Joe Kane Day Parade. Sure did. It was me. I was out there walking through this crowd. No, not walking, tiptoeing, because it was so slow moving, and it was like, how clubs are one way in and one out. But this was like a one way in, one way out crowd. There was no way to run, no way to exit, and you just kept going forward. And when I would usually be out there with my heart beating and trying to push through and snake through the crowds, I was just chilling, just strolling and smiling with this big goofy look on myself, because I could not believe that I had did it. Did y'all see me out there DJing better than DJ Tech? Did y'all see me DJing? I had my tech thing going on in front of a crowd. I was being a DJ at the Mardi Gras parade. So I'm telling you that there is nothing that you can do if you just trust yourself. You got to put some effort into it. You got to believe that you can, even when your mind is telling you that you cannot. So that's my wrap up for the Mardi Gras. Tashina, you said you suffer with social anxiety? Or just some anxiety?
General anxiety.
General anxiety.
Yeah. But I will say, Trish is the first person that has ever introduced me to therapy and not feeling crazy. So I can, my anxiety started for me probably much younger than I can remember. But I know in college it got really bad for me. My last year of school, I was like, I got to get out of here. Like I prayed on the wing just getting through that last year. So I have always suffered, I know for the last 10, 12 years with the really bad anxiety. And so Trish, I talked to her about, I have really bad anxiety and just family things. Like I remember, she introducing this place to me and Daphne, and I still love that place, still hold them near dear to my heart. That was the first therapist I ever sat with. And it has done wonders for me. So I did feel crazy at first. I remember telling them, like, please tell me I'm not crazy. Like, this is normal. People are going through this. Like, this is normal. And they were like, yeah, this is normal. Like, this is basically, like, this is nothing. I've seen worse, cases than that. So
I tell everybody, therapy is how I went from couch to chair. You can do it. Do you do things like that?
Not really. I mean, kind of. But I just started therapy like a year ago.
And
I didn't think that I need therapy until I sat in therapy on that first 3 sessions. And I was like, all right, girl, you need to be here. Sit down.
sit down and breathe.
Yes.
Breathe. And you told us you've been to therapy.
Mm-hmm.
It's raining?
It's pouring down.
Oh my gosh, we gotta go across the bay. So I think that is it. I think that's it. I think that was a good show. Anybody else want to add anything?
Good.
That was great. You're good. All right. So if you haven't already, I've got to tell y'all, and I was not reminded to tell you guys to like, comment, follow, and share, but it's always on the screen. You can still do that. A majority of our viewers will come back and watch later. Our ratings are going up and up and up and up, and it is because of you. So thank you very, very much, because we speak nationally syndicated into existence. Okay,
Right.
we're gonna do that. We're gonna be there. Like I always say, people, whatever you got on your mind that you want to do, just go ahead and do it. Don't worry about what nobody say, because people used to say stuff like, "Oh," when they come to my office, they be like, "Oh, this your little room. Oh, this where you do your little podcast." So listen, God will turn that little room into big things.
That's right.
Okay.
That's right.
And so we speak it into existence. All right, we got on Sunday right here at 3700 Government Boulevard, Suite F, is where we are having a health assistant out. Headshots. Head and body shots with Biz. So everybody should have a professional headshot up. You might get a call to be on the podcast or something one day. So everybody needs one of those. Go on the website, www.healthassistout.com, and you can book your slot to have your headshots done. You get 2 edits in all of your raw shots for $75. So for 10 minutes, she will snap. And then you will pick out your 2. She will give you those 2 edits and all of the rest of the photos you take. And so if you can move and vogue quickly, you can get a lot of shots in. Y'all know it's almost time. June 17th, we're going from teen to turn. So do not miss this year. Everybody is going to be, I know we've been thrilled to be outside, but we inside this year. So that means everybody gets a ticket that wants to be there, but you still got to get on their website and book. We have already sold some tables and some individuals, but we've sold more tables than singles. So don't wait too long. All right. We got DJ Tech on crowd control. We got Octavian Table Johnson. That's going to be our fashion show host this year. Myself and Eunice Mingo will be speakers. I can't see
I'll be booking makeup appointments.
Taisha will be booking makeup. Oh, she is back. Book proper slayage for your makeup. And we got a whole bunch of stuff booked. Brianna is also, I'm not sure because she may be going out of town, but we'll make sure there's plenty of makeup artists out there for you to have your makeup done. What am I missing? I think that's it because we went way over tonight. Anyway, tickets are available at the same spot, www.healthassistout.com. Next week, I will bring flyers with you and let you know who the boutiques that we have lined up for the Tea to Turn event. And that is it. We will see you back next Tuesday, February 28th. Next Tuesday, February 28th. Where Eunice and Anitra will be back. And we will be talking, that will be our self-care and our self-love episode. So, you know, Anitra and Eunice love, like Eunice says all the time, you got to be careful with you. So come back next week, same time, but we'll be back to our Tuesday nights next week for our self-care, self-love episode. And that's it. I'm going to take us out with some prayer, and then we're going to go to the house and hope it start raining, give us some clarity. Father God, in the name of Jesus, God, we are so humbled and so grateful that you thought enough of us to sit us before this crowd of people tonight, for these young women to be able to share their stories and have a provider to come here and give them the support that they needed, the encouragement, and the, you know what, you did that, girl. I'm so glad you advocated for yourself. And we are hoping that they have touched somebody else, gave somebody that may be pregnant right now, or thinking about getting pregnant, so they know what to do if they start experiencing any kind of signs and symptoms that they know are not right, that don't feel that are not them. And so we hope that we've done your will by educating tonight, empowering and inspiring. We ask that you continue to bless everybody in this studio right now, from us to productions. We continue to speak growth, and we continue to speak excellence, and we sign it, we seal it, and we deliver it in Jesus' name. Amen.
Amen.
Good night, everybody.
Good night.